Dietary factors appear to play an important role in the development of both benign fibrocystic changes and breast cancer, and specifically components of a healthy diet might significantly reduce the risk for developing the fibrocystic changes and the benign breast disease. For instance, dietary fiber improves the estrogen metabolism, and diets that are high in fiber have been associated with reduced incidence of some of the benign breast disorders. A study in 675 women with benign breast conditions, compared to 1,070 healthy controls, found the greater consumption of fruit and vegetables decreased the risk for proliferative fibrocystic breast conditions and breast cancer. This effect was most clear when comparing the 1/4 of the women with proliferative breast conditions or breast cancer who ate the most fruit and vegetables to the controls. A similar finding on the importance of diet came from a study which compared 121 women with benign breast disease to 121 women with non-breast related conditions. The study found several dietary components were associated with significantly reduced odds for benign breast disease. Higher citrus fruit consumption was associated with a 57% reduced odds, and higher non-citrus fruit with a 65% reduced odds. Several studies have shown that women who consume more vegetable fats, vegetable protein, fiber and nuts, and less animal fat, red meat and alcohol, are less likely to develop fibrocystic and benign breast changes later in life. Studies have yet to determine if adult women who adopt this dietary approach are at a reduced risk for the fibrocystic changes. A fiber-rich plant-based diet high in healthy fats from sources like olive oil and fish, and low in red meat, is a reasonable preventative strategy. Chasteberry is also known as Vitex agnus castus, and it's commonly used for breast pain in Europe. And the German Commission, a regulatory body that oversees dietary supplements in Germany, supports the use of Vitex for the treatment of breast tenderness, especially premenstrually. In a randomized control trial in 97 women with cyclical breast pain, daily dosing with a solution containing about 32 milligrams of chasteberry significantly reduced the breast pain compared with a placebo. The improvement was observed over 2 menstrual cycles, and half of the patients receiving the chasteberry extract reported they were free from severe pain after the second treatment cycle, with some women reporting the pain relief was noticeable beginning with the first cycle. Chasteberry is believed to exert its effects through the inhibition of excessive release of the hormone prolactin by means of the activity at the dopamine receptor in the pituitary gland. According to a rigorous review of the literature, the chasteberry benefits other conditions influenced by hormonal fluctuations like PMS and menstrual cycle irregularities. A randomized trial compared the chasteberry extract to bromocriptine in the treatment of 40 women with cyclical breast pain and 40 women with mildly elevated prolactin secretion. The prolactin secretion and the breast pain were significantly reduced by both treatments. The authors pointed out the necessity of long-term treatment of breast pain makes the tolerability and low toxicity a priority, so patients are more likely to adhere to a treatment with the chasteberry extract. Lignans are polyphenolic compounds and are present in a variety of plant foods, with high concentrations found in flax seeds and sesame seeds, as well as in certain plant extracts, such as Norway spruce. The plant lignans are converted by intestinal bacteria to biologically active mammalian lignans, such as enterolactone, and enterolactones have been shown to concentrate in breast cyst tissue and potentially mitigate breast cancer risk in certain patients. Both lignans and enterolactones have been studied in pre-clinical settings and observational studies, and they found to have substantial anti-cancer activity. This quality is particularly evident in the protection from breast cancer abnormalities and in an association with reduced breast cancer risk. Enterolactones appear to have an aromatase inhibiting activity. Aromatase is the enzyme that's responsible for creating estrogen from precursor compounds. This property could account for the ability of the enterolactones to protect against breast changes and benign breast changes. Tamoxifen is one of the few drugs used to treat fibrocystic changes and severe breast pain, but it's associated with significant side effects. Since fibrocystic changes are known to be closely associated with female sex steroids and possibly with excess estrogen, dietary and supplemental lignans might be one of the more promising approaches to managing the benign breast changes. A population-based study compared the diets of 121 women with benign breast disease and 121 control women. The women who consumed the most food sources of lignans were 52% less likely to have benign breast changes than those with the lowest consumption of these foods. In a randomized control trial, 56 women with severe cyclical breast pain were given 25 grams of flaxseed-containing muffin per day, while 60 women received a placebo muffin. The treatment phase of the trial lasted 3 months, during which the women were assessed for breast pain, swelling and lumpiness each cycle, as well as the daily breast pain. The median reduction of pain score was significantly greater in the flaxseed group compared to the placebo at the end of the 3 cycles, and there was no significant side effects. A randomized trial in 181 women with cyclical breast pain assigned participants to receive either 30 grams of flaxseed per day in a specially prepared bread, plain bread without flaxseed, or a capsule containing a modest amount of the omega-3 fatty acid EPA and DHA. The intervention lasted for 2 menstrual cycles. The severity of the breast pain was significantly reduced by about 56% in the flaxseed group, 17% in the plain bread group, and 42% in the omega-3 group. 2 professional organizations endorse flaxseed consumption for the treatment of benign breast conditions. The Society of Obstetricians and Gynecologists of Canada recommends flaxseed at the first line of treatment for cyclical breast pain, and the Canadian Cancer Society recommends the consumption of flaxseed for fibrocystic breast changes. Vitamin E was shown to be effective for reducing the most severe premenstrual breast pain, and it showed a trend towards overall reduction of cyclical breast pain in a trial that compared vitamin E, evening primrose oil, a combination of the two, and a placebo. Another study compared women with existing proliferative abnormalities to women with non-proliferative conditions, or women who didn't require a breast biopsy. The study found that women with the highest serum concentration of alpha and gamma tocopherol, 2 forms of vitamin E, showed a trend towards the lower risk of both proliferative disease without atypia and breast cancer. Women with the highest consumption of vitamin E from food had a significantly lower risk of breast cancer, and a similar trend was present for those with the highest consumption of vitamin E from both supplements and food. A dietary study among girls found those who consumed the most vitamin E during adolescence had a significant 21% lower risk of proliferative benign changes as adults when compared to those who consumed the least vitamin E. Evening primrose oil might relieve the breast pain. The gamma-linoleic acid is believed to be the active constituent of the evening primrose oil, and it might be useful in this context. It's important to note that up to 4 months of treatment with evening primrose oil might be necessary for the breast pain relief. A randomized control trial compared 6 months of 3 grams of evening primrose oil, 1,200 international units of vitamin E, and a combination of the two, or placebo, each day for 41 women with premenstrual breast pain. All 3 treatments reduced the most severe pain, with the clearest effect from the evening primrose oil alone. There was a trend for all treatments to reduce the incidence of the cyclical breast pain. Borage oil contains gamma-linoleic acid, the same constituent as evening primrose oil. Iodine might be necessary for the normal functioning of breast tissue, and an iodine deficiency has been shown in preclinical and clinical trials to be related to precancerous and cancerous changes in the breast tissue. In rodents, dietary restrictions of iodine creates a syndrome very similar to fibrocystic changes, and in another study, supplementing rodents with iodine was shown to suppress breast tumor growth. Lower incidence of benign breast disease occurs in Japanese women, and some researchers hypothesize this might be related to the greater iodine intake in this population via the consumption of seaweed. A review of 3 clinical studies found that treating women who had fibrocystic breast changes with an iodine or iodide led to a clinical improvement in about 70% of the cases. Side effects of iodine treatment can include changes in thyroid hormone levels, acne, headaches, thinning hair, and others. Therefore, iodine supplementation should only be done when blood tests to check thyroid function are also done. Supplementation with the beneficial omega-3 fatty acids EPA and DHA might effectively reduce the cyclical breast pain and lower the risk of fibrocystic breast changes. A randomized trial gave one group of women with cyclical breast pain a daily omega-3 supplement containing 180 mg of EPA and 120 mg of DHA. In this group, pain intensity was significantly reduced by about 42% after 2 cycles among the women who received the omega-3 supplement, while the women who didn't receive the omega-3 supplement experienced a reduction of only about 17%. In another study, women with the highest EPA concentration in their red blood cells had a 62% lower risk for developing fibroadenoma compared to women with the lowest EPA concentration. Similar results found that women with the highest red blood cell EPA concentration had a 67% lower risk of non-proliferative fibrocystic changes than the women with the lowest red blood cell omega-3 concentrations. Vitamin D deficiency is strongly linked to breast cancer risk, and it might be associated with fibrocystic changes. A study that compared vitamin D levels in women with no breast lumps, fibrocystic changes, or breast cancer found the severe vitamin D deficiency of blood levels less than 12.5 nanograms per milliliter increased the risk for breast cancer by 3-fold. Importantly, women with fibrocystic changes had vitamin D levels higher than women with breast cancer, but lower than healthy controls. One trial found that women who consumed more than 533 international units per day of vitamin D from the diet or supplements showed a trend towards the lower incidence of proliferative benign breast changes. A survey in 682 women with proliferative breast changes found that those in the highest 1/5 of the vitamin D intake during adolescence had a 21% lower risk of proliferative benign changes compared with women whose intake was in the lowest 1/5 as adolescents. Indole 3-carbinol and di-indolemethane are related molecules, and they're found in the cabbage family vegetables like broccoli, kale, and cauliflower. The indole 3-carbinol is metabolized in the body to form di-indolemethane, a biologically active compound. Both of these can modulate estrogen receptor activation and estrogen metabolism properties, and this can help to counter the known role of estrogen excess in fibrocystic changes. Neither the I3C or the DIM have been studied in a clinical setting for the treatment or prevention of fibrocystic changes. However, rats who were treated with dietary I3C showed a reduction in the incidence of fibroadenomas. More studies are needed before conclusions can be reached about the role of the I3C and DIM for the treatment of the fibrocystic changes. A study in which the higher consumption of fruits and vegetables significantly decreased the risk of proliferative fibrocystic breast conditions and breast cancer also found higher consumption of grapes was especially associated with a lower risk of proliferative fibrocystic breast conditions and breast cancer. The authors of the study pointed out that resveratrol, a natural polyphenolic compound present in the grapes and related foods, has powerful anti-cancer effects. For more on herbs, supplements, and natural treatment plans, check out my website.